Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Mountain Moving Faith. This is my latest book. And if you want to learn how you can move mountains, life has many mountains. While this journey, you will encounter mountains and you wonder, how can I move mountains? This is a book to read. And it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration. It is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on Mountain Moving Faith. Call that number or send a message and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift. And I have no doubt they will thank you and that they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
Hello there and welcome to the Healthy You program, your favorite health program on Faith Today television. My name is Enock Kitondekijja, a medical clinician and your host. Allow me to start by recognizing JCK Hospital, the official sponsors of this program. You can find them in Roysambu along Lumumba Drive, just next to Happy Life Children's Home. They are also in Juja Farm. You can also find them in Mariaini. Those in Muranga, you are sorted. Today is a special day. We are going to be discussing a very interesting topic that I know most of you have experienced it. This is a condition that some of us take casually, but today we have a general surgeon who's going to be helping us break it down, understand what it means for you to have heartburn. Some of you call it acidity. What does it even mean? We have an expert in the building. And before I invite him, I'm aware we have so many of you who are following us on social media. We want to celebrate you, we recognize you, and we want to remind you to please subscribe. Do not forget that, very important. Like this conversation, if you have any question regarding heartburn and acidity, this is a time when you send it in right away using the number that is on your screen. Again, welcome to the Healthy You program. Back to my guest. This is Dr. George. He has a very huge CV. He has been in the practice for a long time. But I want him to fully introduce himself so we can really understand who he is without missing out on anything. Dr. George, you are welcome to the show. Please introduce yourself.
Thank you. My name is George Njihia. I am a general surgeon practicing in the Republic of Kenya. I'm very happy to be here today. Thank you for hosting me. Just to serve as an introduction to myself, I practice as a general surgeon, mostly along Thika Road. I also work with JCK. within the facility. My background, I started off as a clinical officer. I did a diploma in clinical medicine, then proceeded, did a degree in medicine, and then finally did my master's in general surgery. I have a specific interest with gastroenterology, that is a study of the abdomen and primarily the intestines and the surrounding structures around that. Every structure that serves to support the gastrointestinal system. So that will include your stomach, the food pipe, the intestines, the gallbladder, the pancreas, and also the anal canal. Those are my major areas of specialty, major areas of interest. We look forward to having to work together, discuss together about this topic of acidity. It's a common issue that is disturbing quite a number of people. It reduces your quality of life. You find there is, for example, people with acidity and heartburn and bloating and all those conditions that entail that cannot enjoy life. For example, if you've gone to for a wedding, you cannot enjoy the meals that have been served because your tummy will give you a problem. Sometimes if you've been married, you've been taken on honeymoon, you want to go and explore all the exotic foods around you, you can't explore that because your quality of life is poor. Sometimes people tend to be very selective of the kind of foods they eat, and as a result they lose important nutritional benefits from a variety of foods, and they usually tend to come in with issues with malnutrition. Key of them is usually mostly anemia. So it's very common to find people who had a constant disturbance of the abdominal region having things to do with malnutrition and having anemia. The other thing is that this condition of heartburn and acidity, if you don't control it very well, you don't get to the reason why you're having your heartburn, you don't get to understand why you're having acidity. If it's not controlled and it goes on for a prolonged period of time, it leads to malignancy. That means it leads to cancer. So it's one of those conditions which you can say cancers that are led or usually caused by heartburn and acidity, they tend to be preventable by addressing the reason why you have acidity or you have your heartburn. I think that's it for an introduction. I would like us to get into the nitty-gritty details. Looking forward for the conversation.
And that is quite interesting to have a man like you who is having that a long array of accolades. You've taken so much time in studying this medicine, and I appreciate that, because I believe that is what our viewers need. They want to really be confident dealing with someone who has that kind of experience. And you've talked about people having the phobia or fear of eating some foods because they have that kind of heartburn and acidity, things like that. For those of you who are just joining us, this is the show that you don't want to miss. Have you had an episode of heartburn? Have you been a bit hesitant to eat certain foods? We have an expert in the building to help us break that down and address this pressing issue. To kick off, Dr. George, help us understand the difference between acidity and heartburn. And also, how does it typically present in people?
Okay. So acidity and heartburn are synonymous with each other. So if you say you have heartburn or you have acidity, you're basically describing the same condition but with different language. Now, normally the stomach has acid in it, hydrochloric acid, which has a very low pH, pH of 2. So that means it's a very strong acid. Now, the strength of that acid is considered quite significant because it can corrode metals, it can corrode many things, including metals. And God has created our stomach in such a way that there is an inner lining that protects the acid from corroding your stomach or your intestines. Now, that acid becomes a problem when it goes outside the normal parameters where it's supposed to be. So as I said, the acid is supposed to be inside the stomach only. But remember, as you swallow your food will go through your food pipe, then gets into the stomach, then goes to the duodenum, which is the first part of the intestines. Then the second part is the jejunum, ileum, colon, like that. And then eventually whatever is the waste products come out through the rectum and the anal canal. So when your acid goes outside the normal parameters, that's the time you get acidity. Now, people, what they describe as heartburn is because the heart is in the chest and there's a burning sensation along this part, which is where your food pipe is located. So where the food pipe is located is because it has come into contact with the acidity, with the acid, which is supposed to be inside the stomach. So there's a valve that is located between the food pipe and the stomach, known as a lower esophageal sphincter. And the purpose of this sphincter is to allow food to get into the stomach. And once it gets into the stomach, it does not come back into the food pipe again. So when there is a weakness over that valve, or there is a problem with that valve, or there are external factors around your chest, as we shall discuss later on when it comes to a condition as hiatus hernia, if there's a condition around your chest or within the abdominal cavity that tampers with that valve, you'll always end up having that acidic contents finding their way into the food pipe. When they find themselves in the food pipe, you end up now with the sensation of heartburn. The other thing is that due to a reason or another, maybe the lining of the stomach has been affected, and now that makes the acid comes directly into contact with your stomach muscles.
And I think that is what our viewers really want to understand. What messes up with our lining, internal lining?
Exactly.
Yes.
So number one, let's talk about the food part first. What messes that region is if there's a weakness with the valve. Okay, so the valve may be weak, or you may be having a motility disorder where the normal way the esophagus is supposed to push the food into the stomach, that mechanism is tampered with. As a result, there is food stagnating around that region, leading to lead to a dysfunction within the valve, hence allowing acid content into the food pipe. That's number one. Number two, if you get an infectious process within your tummy, for whatever reason, that tampers with the lining of that protective layer of the stomach. This allows the acid to come into contact with the muscles of the muscles of the stomach. That gives you, the ulcers. Ulcers, you'll find there are many people who keep on saying, I have ulcers, I have ulcers, I have ulcers. And the bigger question is usually, how was this ulcers diagnosed? So the best way to diagnose ulcers is through endoscopy, where you actually literally come in with a camera, study the inner lining of the stomach, be able to identify the ulcers, and sometimes you go as high as taking a sample of the ulcers. The commonest cause of how these ulcers or this disruption of the lining comes to be is usually through medication. People who are chronically on use of anti-steroidal, anti-inflammatory drugs, they're known as NSAIDs, things like brufen, diclofenac, meloxicam, mostly painkillers. Okay. People who have chronic back pain, chronic knee pain, chronic leg pain, people who have been on steroids for a reason or another, people who are asthmatic, they tend to be on steroids therapy. People who are on kidney transplant, for example, they are on steroid therapy. People who are treating autoimmune conditions, things like lupus, for example, they also tend to be on steroid therapy. So steroids are a common cause of ulcers within the stomach.
Meaning, it is not only the blockage you talked about and the infections,
yes,
but also the drugs we take,
yes,
can also lead to these ulcers and things like that. Before you go any further, because I realize you're giving us quality info, and I don't want to lose any of our viewers, you talked about that lining and then the ulcers. Is it true that every person who experiences that pain has ulcers?
No, not always. Majority are, but not always.
So that it comes after you guys diagnosing it?
Yes, because most people usually say I have ulcers, but they have never had a chance to be properly investigated. And the most proper investigation is either you do a barium meal, which right now is not very commonly used, but the best way, the gold standard, is to go by endoscopy, where you come in with a scope, we examine the inner lining, and if we find the ulcer is there, we collect a sample of it. And as I said, the common thing is usually people have this heartburn that they usually think is ulcers, and also there's not the actual ulcers. The other thing that is very common in our setting is H. pylori. This is a bacteria that is found in our foods and water. Unfortunately, our sanitation as a country is not very ideal. Most of the time when you walk through the streets of whether it's in neighborhood or within the city, you'll find the sewage right, left, and center. And this H. pylori is spread through food and water contamination. So what the H. pylori does, it has a hormone. It produces a hormone known as urease that neutralizes the acid around where the H. pylori bacteria is located.
It's trying to protect itself.
It protects itself. So as it's protecting itself, it creates then the immune system comes to attack that bacteria. So the immune system is attacking the bacteria, it also affects your inner lining. So you find the immune system in the process of killing the bacteria, the H. pylori bacteria, also ends up irritating your bowel. And immediately that H. pylori bacteria dies, there is a space that is left around there. So acid finds a way of coming to get into the space where the H. pylori was located. And that is the concept behind most of antacid medications, especially the syrup medications. They have molecules in them that come and coat those ulcers, so that it allows time for your body to regenerate again. The stomach is one of those organs in the body that are very forgiving. They heal very fast. The stomach heals very fast. As long as you eliminate whatever the problem is, it has a very fast healing. So once you take your medication and the wound is basically covered, the same concept, if let's say you got an injury on your hand, you come and cover with a clean cloth or a sterile dressing, your body is able to grow again and fill up that defect. So the same thing with the stomach. Okay, so once there was an ulcer, you eradicate whatever the bacteria was or whatever the reason was behind that. The body is able to regenerate and it recovers fully. The biggest concern with this H. pylori treatment is that it's usually a long period. One, H. pylori is treated by a combination of drugs. So mostly there are 3 combinations, and some of the drugs that we use are fairly nauseating. So most clients tend not to complete their dose. So it's supposed to be a 14-day treatment, but you'll find somebody took for 2-3 days, felt better, but because they're having this feeling of nausea as a side effect of the medication, they don't take their medication to completion. So, and as you know, failure to complete your dose leads to drug resistance. So the next time when you're having a repeat of the same kit again, most likely the bacteria has already developed resistance to whatever treatment you're giving. So resistance to medication is coming out very strongly as to why people are not being cured of the H. pylori. So I'll encourage our viewers, kindly complete your dose. It's only where we can help prevent this resistance to antibiotics and other microbes. Yes.
I think that's very important because if people do not follow the prescription as you have directed, it comes with a lot of costs. And I like the fact that you've now helped us understand that not everyone who has the heartburn is also having ulcers.
Yes.
It is until you guys diagnose it. So we want to know, because you've also a bit loosened up and told us that the stomach is a bit forgiving. It can heal very fast, and you know, people may take that for granted. So when is it the right time when is it like serious that someone should seek a medical attention? Because you can have this symptom, maybe 3 days you feel much better. You go to a pharmacy, you know, they give you these over-the-counter drugs, you feel a bit of relief, and then you're good to go. That's how you think. But when is it serious? Because you are a surgeon and you handle most of these cases, but the root cause, you know, you always date it back to the heartburns. So when should someone really seek medical attention?
Now, number one, with most conditions of the abdomen, are usually food related. So, and most conditions tend to be self-limiting, meaning if today you took something, let's say you took a samosa for your breakfast, and maybe it was samosa that was prepared last night, it may give you a bit of a tummy issue. Your body is built in a way that whatever irritates it, it pushes it out. So automatically, once you eat something that is bad for your tummy, your body will induce a mechanism of either you vomit it out or you have a diarrhea. You understand?
Yeah.
So for us to be worried about any diarrhea, we need to have at least 4 episodes or more. So if you start having 5 episodes, 6 episodes, that's now time for us to say we need medical attention. Are you together?
Yeah.
But if you eat something right now and you have maybe 2 or 3 motions of loose stool, that is your body taking care of its own business without either surgeon or any other physician being involved. But if you start now getting now into your 5th motion, that's the time now for you to seek medical attention. With heartburn, most of the time it's also self-limiting. If let's say you went for a wedding, for example, or you went for a birthday, or you went and you made something of a tea break and you ate and it gave you a bit of discomfort. Most heartburns tend to be self-limiting, and self-limiting is within a day or less. If you find your heartburn is going beyond the day, you had your tummy today, disturbs you during the day, during the night, tomorrow morning you have the same, please come for attention. Vomiting, we usually say if you vomit more than twice. Okay, if you have you've eaten something, you had the first motion of vomiting, that's your body taking care of its business. You had another motion, another episode of vomiting. If you have a 3rd episode, please seek medical attention.
Like 3rd episode, doctor, talking of how long, in a day, in a week, in a month?
No, within a day.
Within
a day.
Okay, so that means if I have 1 episode today, and then I have the other probably tomorrow, that should not worry me.
That should not worry you. Okay. But vomiting is not very normal.
It's not normal.
Unless you are pregnant or you're on medication, or sometimes the medication which usually induce vomiting. For example, if you're being given some injections, especially in a hospital setting, you'll find in the course of that administering that drug, you have an episode of vomiting, which tends to be limiting for a few minutes. Then that's it. Okay, then until the next time you're having the injection. At least we know the reason behind your vomiting is because you're having the injection given. But now, assuming you eat today, you vomit within today, and then now the same thing recurs tomorrow. No, come for attention. It's if you have two episodes within 24 hours. Okay, the 3rd one, please seek medical attention.
What could go wrong in case I do not, because this is a very sensitive question right now, because I believe if we don't address it, one of our viewers may not be happy with us. So help us understand, in case I don't come for that attention. I've vomited, I've taken it lightly, because we are busy people looking for money, we are up and down and things like that. Could think probably maybe I'm stressed, and then you let go. What could go wrong in case I don't?
Number 1, your quality of life is impaired. Assuming you're a media person, and right now you feel like vomiting, and all of a sudden you vomit at this particular set, it's very uncomfortable for the people behind the screens, for your viewers outside. They'll think you're dying, my friend. Okay, so it may not be life-threatening, but the perception of your quality of life is already impaired. Sometimes we've seen senior government officials who have had a problem. Okay. Maybe someone was in a very strenuous meeting, could not go to the washroom for a reason or another, and they had to come out and do a photo session before he goes to the washroom. If he happens to pass urine on himself, automatically people start thinking, this guy is very sick, has many issues like that. Now back to our conversation on vomiting and diarrhea. Number 1, the quality of life is impaired. You're not even able to focus on whatever you think you're focusing on, because you'll think you're going to vomit on it. For example, if you're working on a computer, for example, and you happen to get an episode of vomiting and you vomit on your computer is spoiled. So it affects other things. Okay. Number 2, when it comes to your body, you're losing essential elements in your body. So if you don't control your vomiting and your diarrhea, you'll end up with kidney disease. Sometimes if you vomit too much, you can start tearing part of your, remember the stomach is acidic, so you're exposing that acid to the food pipe, and the food pipe cannot handle that acidity, so you end up with now ulcers on or tears within your food pipe,
Yeah.
that can give you bloody vomiters.
Yeah.
Okay, so those are other complications that can arise. So you can have a kidney failure, you can have other wounds that have developed, and of course your quality of life is impaired.
The quality of life in this is very important. For our viewers, those of you who are just joining us, we have an expert in the building, and you can tell he's giving us quality information regarding the heartburn, that acidity you've always taken lightly. He's telling us that as long as you vomited more than once in a day, that is something that you need to really pay attention to and probably seek attention, because he has talked about other extra organs that could be affected. We're going to take a short break, but before we do, Doctor, help us understand some of these myths, because a lot of dogma is going on around heartburn and acidity. What are some of those myths, and how do you go about them?
There are people who have gotten accustomed to having acidity or the heartburn, and they believe that is a normal way of life. Ideally, it shouldn't be like that. You should be able to enjoy life to the fullest. Okay? There are some who will say it's because my grandfather said, or my grandmother did, or my auntie did, or said something like that. Or it's because we as a family tend to have this condition, so it is part of our lifestyle. Ideally, you should have a comfortable life. It's the same thing with old age. As you age, people tend to remove their teeth, but that is wrong. You're supposed to die with your teeth, all of them intact, not die without your teeth. So even with acidity, you're supposed to sort it out, not for the sake of improving your quality of life. Okay? Yes.
Wow, that is very interesting. So meaning it is not normal for you to have the heartburn.
Yes.
As much as you can go and get a quick fix or things like that, it is never normal. You need to seek attention.
Yes.
That's very important. And we are going to take a short break. And when we return, Doctor here is going to help us understand how can you prevent this this condition. How do you deal with heartburn when you have it? He's also going to help us understand the surgical part of it. When does it come to that level? When do you need to go in for a surgery? He's so much endowed with a lot of information that I don't want you to miss. And again, I'm waiting for your questions. If you're sending in your questions, please do so much. I also want you to help us understand in the second session some of the how can someone balance. There's that fear. They always tell us about there are certain foods you can avoid. You're not supposed to take all these foods. It can hinder, it can affect. I want you in the second session to help us understand that, because I know for our viewers who are preparing for Christmas, that is some of the information that they don't want to miss. You also talked about malnutrition in the second session. You're going to tell us more about that?
Yes.
Perfect. For our viewers, that is the reason why you don't want to miss the second session. We are coming back. Do not change the dial.
Okay, asante. Nilikisajili kitabu ambacho kinaitwa 7 Keys to Success, ama kuna kanuni funguo 7 if you like it, ambazo zitakuletea ushindi na kufaulu maishani. Wote, wewe na mimi, tunataka kufaulu, lakini pia kuna njia ya kufaulu. Ukisoma hiki kitabu ambacho nilikiandika kwa kufanya utafiti, kwa maombi mengi, kuangalia neno la Mungu, I have no doubt ya kwamba hiki kitabu kitabadilisha maisha yako. Nilikuwa naongea na mchungaji rafiki yangu, akaniambia nilisoma hicho kitabu, sasa ninafundisha watu wangu kupitia ujuzi, maarifa, hekima ambayo nilipata kwa hiki kitabu. Kwa hivyo unaweza pia nunulia watu wengine, na akaniambia alinunulia hata viongozi wake, na wamekuwa wakisoma, wakaweka kwa library yao wanasoma. Hiki kitabu sina mashaka, nina uhakika kitabadilisha maisha yako na utabarikiwa. Tuma message ama upige simu kwa hiyo namba, na naweza kuwasiliana na wewe na utapata hiki kitabu, utatumiwa, usome na ubariki pia watu wengine. Asante. Mungu akubariki unaposoma 7 Keys to Success, and you will succeed Thank you.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. Welcome back to our second session of handling heartburn and acidity. We have an expert in the building, Dr. George. And those of you who have been following us, you can tell he has so much for you to learn about heartburn, get rid of it, and also improve your life, because quality of life here is at stake if you really don't take serious. Most of you have been struggling with heartburn, you get an episode of vomiting, and you take it lightly. But before it becomes worse, there's so much that you need to know, and so that you can live a healthy life, very important. When we took a break, Doctor here highlighted something very important. I know most of you have been told, don't eat this food, it can help with the ulcers. This can bring the ulcers, this can bring heartburn, this can not bring heartburn. There's a lot of what people say concerning the food we eat. So we want to understand, is the food that you are eating the cause? Is it to blame for your heartburn? And if so, how should we attempt to this? Of course, in the first session, he told us about the infections that come in with the foods that we eat. Is it true that every food that we eat is predisposing us to this heartburn? Yes, this is the show. Doc,
yes.
Let us begin with that.
Number one, in God's wisdom, He said we can eat very many things. And there are things the book of Leviticus says we cannot eat, which in some communities, they still eat those things. It all goes down to how your body handles the food you eat. There are foods which normally have a lot of gas, for example. If you take legumes and cereals, you'll find they tend to have a bit of gas. Things like things like beans and black beans and peas, they tend to have that bloating. They give you gas. So the foods that you eat can give you gas. Another common thing that is coming in strongly is salt. There are people who oversalt their food, and most of the additives we have in our foods tend to have salt in them. So this excess consumption of salt, on top of having other issues like hypertension, triggering your issues with fluid overload and things like that, they also cause bloating or abdominal issues. The other thing is that we are finding our people are taking more and more of alcohol. Even younger people are becoming more of taking alcohol. So alcohol tends to give people this heartburn and also give them gas. So you need to identify foods that are working for you and those that are not working for you. Sometimes when you visit some nutritionist, they'll give you a list of foods that usually cause heartburn or cause the gas or cause discomfort in your tummy. And they'll give you a long list of what to avoid. I don't like that approach professionally, because sometimes you look at the foods that they've been told to avoid, and that is what the patient is able to access without any hurdles. And the foods which they can be able to take tends to be outside their economical scale, tends to be a bit expensive. So I believe the most important thing is to identify the reason behind why those foods are not compatible with your body. There are people who have things like lactose intolerance. They know that if I take milk, I'll get a tummy problem. Now, for them, they are advised to avoid milk. However, there are other versions of milk they can take. They can take things like soy milk. They can take things like coconut milk. They can take things like yogurt and cheese, okay? Processed in a way. So our foods become a problem based on your underlying medical condition. There are those who have intolerance to certain foods. Those ones, there's nothing much you can do about them. But there are those who will say if it's maize, if it's your beans, you can prepare them hand in hand with a nutritionist, under the guidance of the nutritionist, how they can be of benefit to you. But the major problem is people don't have the right diagnosis. As a result, they avoid certain types of foods, which by extension leads to malnutrition and anemia. Okay?
Malnutrition meaning?
They don't have nutritional values in them
From the food that they
from the food they are supposed to benefit. For example, there's someone who doesn't take citrus fruits, and citrus fruit is what they're able to access. At the same time, they cannot be able to take green kales, like in a sukuma wiki. They're not able, and that's what they can able to access. They can't be able to get spinach. That's what they're able to access. They can't take cabbages. So at the end of the day, when you look at the diet plan of this patient, has zero access to vitamins because they are not able to access other non-citrus fruits within their locality. So they'll come in with nutritional deficits that you appreciate within the scale of vegetables and fruits.
Yeah, and even the immunity.
Yes, so the immunity goes down, so they are prone to many infections. They start getting cracked lips because they are developing vitamin C deficiencies and things like that. So the only way you can compensate that is now giving them supplements through multivitamins and all those kind of things to supplement whatever they are not able to get through food. But I always believe the best way is to get your nutritional value from food rather than supplements. If you can give it through food, it's better than giving you through a pharmaceutical arrangement. That's one. Number two, your inability to eat foods means your quality of life is poor. You understand?
Yeah.
You cannot be able to enjoy life. At the end of the day, we're in this world to enjoy life. And as doctors, our job is to make sure that you're able to go through life comfortably. So you cannot be on a meal plan that does not allow you to enjoy life. You understand? Yes. So we need to work closely with a nutritionist and look at what the patient is able to access. Okay. And if they're able to access, whatever they're able to access, it should be of nutritional value to the patient.
Wow, quite interesting.
Yes.
And then, speaking of that, I believe we can take now some questions. Mm-hmm. We have Nancy from Zimmerman. Mm-hmm. Says, hey, Daktari, I often get this burning feeling in my chest after meals. Is that normal or should I be worried? I often get this burning feeling in my chest after meals.
Now, there are two things there. Could be one of two things. One, she could be having a motility disorder. That means when she eats her food gets stuck within the food pipe. So that time when she's taking her food, she feels like there's something stuck within the food pipe. Okay? Number two, she may be having, also in the region of food pipe issues, she may be having a hiatus hernia, which I believe is more common than the other one of food getting stuck. So that hiatus hernia means that part of the stomach is inside the chest cavity, because the diaphragm, the muscle that separates the chest and the abdomen, has a wide space that allows part of the stomach to get into the chest cavity. And that is very common because once she eats to her fill, she finds there is pain within the chest cavity, and sometimes that pain goes all the way to the mouth, because she'll find it easier when she belch, when she removes gas from the stomach, akiweza kubelch, the pain usually subsides. So one of the mechanisms that we usually advise such clients is eat small meals many times So that means you are eating every 2 to 3 hourly, something small. Make sure it's balanced diet, because sometimes you find that, as I said earlier, the issue about food, people avoid certain types of food, they end up not having a balanced diet.
Yeah.
And then the other thing that usually causes pain after eating food is the gastric ulcers. Okay, because when you have when you eat, your stomach produces more acid. As if you have an ulcer, the ulcer is exposed to the acid part.
Okay.
So it's either she has an ulcer, or she has an issue with the food pipe, or part of the stomach is inside the chest cavity. So she needs to do an endoscopy to diagnose exactly why she has that.
Yeah.
And then once you get the reason why she's experiencing that, she can be treated and continue enjoying her food.
Her food.
Yes.
All right, Nancy, you get your answer over there, and there are very many possible likeliness for your condition, but you cannot confirm or diagnose right here. It is important that you go to these medical people. They are going to help you ascertain the real cause and also advise on your way forward. But being often, that's not normal. You need to really seek more attention. Then we have Martin. Morning. Is there a connection between heartburn and other health issues? Should I be concerned about my overall health if I have frequent heartburn?
Good question. Heartburn comes with other issues. Most often than not, the chest pain usually goes to the left side. So there's a typical, known as atypical cardiac pains. So you have a pain of your heart, but it's not the typical cardiac pain. So it's not uncommon to find that someone has heartburn issues, but they are being investigated for a heart problem. The other thing is that they usually get asthmatic events, especially if you have heartburn. The acid that you bring up finds its way into the lungs, and that triggers an asthmatic kind of an experience. So you find there are patients who frequently they are on treatment for asthma, and actually their problem is the heartburn. The other thing is you can get an issues with your throat. So you find there are patients who have hoarse voice. When they are on antacids, their voice is okay. When they stop antacids, they get a hoarse voice. And in some instances, you get tumors developing courtesy of the heartburn that you are experiencing. Then, of course, there is a gallbladder issue. The pain of gallbladder usually tends to mimic that of heartburn. So if you have a problem with your gallbladder, especially if you have stones or an infection of the gallbladder, you'll get that. The other thing is pancreas. So you may eat, then as the pancreatic juices are being produced to help with digestion, they trigger pain that mimics heartburn. So it's usually very important to come for an examination. We take a thorough history, we see how it is behaving. Of course, if you have pain on the left side of the chest, we always say rule out the heart. The heart is one of the biggest engines. We are here courtesy of the heart. Yeah. So if the heart is clear, then now we start investigating the issue of heartburn. Wow. So there are many things that can be related with the heartburn.
Wow, that's very interesting.
Yes.
And more profoundly, you talked about the hoarseness of the voice. I live in a community where people probably talk a lot. Some of them are into singing. You know, sometimes you get that hoarse voice, and you'll find a safer remedy. You use the honey, and then you buy these antacids. It is okay. Probably you may think it's because I'm talking a lot. Kumbe, there's something really underlying.
Especially if your sore throat, your hoarse voice is resolved by antacids, have your heartburn issues addressed.
Okay.
Yes.
Perfect. And then we have another one. I want to remind our viewers, if you're sending in your question, remember to send in your name as well and where you are asking from, so we can follow up on you so well and ensure that you get the best from this program. We have, she didn't specify, but she says, I'm pregnant and struggling with heartburn. Are there safe remedies I can use without harming my baby?
Yes. Number one, what you need to understand when you're pregnant is a very hot potato. Your hormones that maintain your baby inside your uterus are the reason, or rather the major reason, why you are having heartburn. So the hormone is known as progesterone. It relaxes body parts. Remember, your body is growing. So as the uterus is growing, it needs to be relaxed enough to allow your baby to accommodate, to be inside that uterus, until the time when there'll be a drop in the progesterone level. The time of delivery comes, so the progesterone levels come down, other hormones come into play, and you go into labor. You understand? So your baby is inside your uterus, courtesy of your progesterone. Now, this progesterone causes other body parts to relax. Remember, we discussed about the lower esophageal sphincter. So that sphincter, the one that blocks the acid content inside the stomach, not to find its way into the food pipe, that sphincter relaxes, courtesy of your hormonal issues. So when that sphincter opens up, you end up with now that reflux. It's the same thing that usually causes women to have back pain and have hip pain and to have pain over the pubic symphysis around that region. And it's the same reason why they usually tend to have urine incontinence. When someone laughs a bit, urine seeps out. It's because the hormones are into play. Of course, also there's also the issue of pressure. Remember, the uterus is growing, the baby is growing, so there's more pressure within the abdominal cavity that also can cause the heartburn to come up. Yeah. But the major problem is your hormones. Yeah. Now, when you're pregnant, we cannot tamper with your hormones, because we need you to deliver your baby to the end, to carry your baby to the end. So we usually give you antacid syrups. Most of them are commercially available. Sorry, but pambana na hii hadi mwisho. Struggle with it to the end.
Yes, yes.
Then once you go into your puerperal region, that is the first 6 weeks of pregnancy, and it persists beyond the 6 weeks, the first 6 weeks of after delivery, that time now come to us. We investigate, but of course, because we usually try to do as minimum as possible on pregnant women, so that we protect the baby. If you are doing anything on a pregnant woman, you have to have the knowledge that whatever you're doing may cause problems to the baby. So we usually try to be as minimum as possible. So what she can do is maybe have an examination of the stool, be sure there's no H. pylori, and just that, and just take antacids. Okay. Then 6 weeks after delivery, she can come for a consult if the acidity is still persisting. Okay. It's a very tough moment.
This is I get you, and this is under constant observation of the medics.
Yes.
Good. Thank you so much. I feel people are really getting so much value out of this.
Yes.
I have another question from, she didn't specify. Is it true that stress can make heartburn worse?
That's a whole topic on its own. What stress does, it leads to production of stress hormones. Now, these stress hormones are in the class of steroids. As we discussed earlier on, steroids usually have an issue with thinning of the mucosal lining of the stomach. And as you have that thinning of that mucosal lining of the stomach, the acid, this mucosal lining is what protects your stomach from the acid inside the stomach. So as it thins out, the acid gets a chance to get into contact with your stomach wall, and as a result, you get ulcers. So we usually say avoid stressors, because those stressors are what leads down to the stress hormones, and the stress hormones are in the category of steroids. So if you hear steroids causing ulcers, it's the same concept as stress causing ulcers.
Wow, that's quite interesting. So we have Faith here, says, this one is asking, hello Faith today. I've tried over-the-counter meds, but not working for me. What should I do?
Number one, she needs to come for a consult. Number two, we get a good history and a good physical exam. Then once we marry the history and the physical examination, we shall be able to determine what are the best investigations for her. And then once we get the reason behind why she has her problem, we give her good treatment. Remember, this acidity problem is all about quality of life. You cannot be having a pharmacy of antacids in your house. Every day you're buying. So you need to have something that will help you with the antacid issues.
All right. I think that's very important.
Yes.
Before I forget, I know one of our viewers would want to understand. You talked about the different remedies. If it's a bacterial cause, then you deal with the bacteria. If it is an obstruction, you deal with the other obstruction. If it is a hiatus hernia, how do you deal with it?
Hiatus hernia, as I said, the hiatus hernia is part of your stomach has gone into the chest cavity. and typically presents with pain in this region, in the epigastric region. This is where the two ribs come together around there, and it usually feels like there's something heavy around there, which when you sit up, there's a relief. When you belch, there's a relief. And this pain is worse after feeding. Okay, after you finish your meals, you feel the discomfort a lot. And sometimes that pain goes all the way, comes all the way to your throat, all the way to your mouth sometimes. So the hiatus hernia has grades. There's a grade 1 all the way to grade 4. So grade 1 and grade 2, they are mostly medical management. We'll only do surgery on them if they persist. Or if you find it's a grade 3, we can try to manage medical management, but eventually you'll need surgical intervention. A grade 4 has no option. You just have to go ahead and operate. So basically what we do is to seal up the defect on the diaphragm, and then we strengthen the lower esophageal sphincter by doing a stomach wrap. I think that can only be explained when the client is inside the office, because it has nutritional implications. The surgery for hiatus hernia has a bit of a long recovery. So, and I usually advise patients between 1 month to 2 months, depending on how complex the surgery was. The first week to 2 weeks, you're on liquid diets. That means you're on water, porridge, milk, tea, things like that. After that period, you go into a period of blended and mashed foods and mincemeat, and then after that now we start introducing your meal one at a time. So that discussion is best held in an office, because there's also a period of how you're going to recover at home. All right, so that's how we deal with hiatus hernia. But the first step is to make the right diagnosis, know why you're having your problems, and what you can do about the problem that you have.
Wow.
Yes.
Good. And then we have a question here from, this is Lynn. Questions are coming in handy. Lynn from Thika. She says, I love the show. How do I know my heartburn is not something like GERD?
You just have to do an endoscopy. There are features that you'll find on endoscopy that will tell you that this patient has GERD, and or there are any other problems behind the heartburn. Patient needs to come for an endoscopy and we find out. Sometimes we go beyond the endoscopy. Sometimes we have to do a CT scan, we have to do x-rays, we have to do ultrasound, all those things. So as I said, the heartburn issues can be from other sources. You can have a problem with your gallbladder that mimics that of a heartburn. You can have a problem with your pancreas that mimics that of a heartburn. You can even have an intestinal problem that shows that comes in mimicking features of heartburn. Yes.
Wow, that is quite interesting, because now you gave us a broad understanding that heartburn is not something that you diagnose or deal with at home. It is important you understand the real cause, address that, and then deal with it.
Yes.
Perfect.
Interestingly, actually, just before you go to the next question, interestingly, after we've done surgeries of these patients who have heartburn, the first thing we usually ask them, what do you normally drink that gives you problems? Well, you're still in the hospital setting. Yeah. Because we do the procedure today, then tomorrow, the following day, you start your drinking. Yeah. So let's say someone says, if I take tea with, if you take any tea leaves, or I take coffee, or I take yogurt, or I take something like that, that usually triggers my heartburn. So I usually tell them to drink that when they're actually inside the hospital. And symptoms usually resolve. It's usually like there's resolution of symptoms immediately. Yes. Wow. So once you know the reason, your quality of life becomes better.
We're talking about quality of life here.
Yes, very quality of life. Because it's this heartburn thing rarely kills. It only kills you when you get a cancer out of it. But before you get to the cancer part, you've had 15, 20 years of poor quality of life. You went through high school, boarding school, your life. You are considered a special child because you couldn't eat what the other people were eating. You went, if you finished your high school, if you are in a boarding setting, outside life, you're not able to enjoy what other people are enjoying. You cannot enjoy your soda, you cannot enjoy your yogurt, you cannot enjoy, let's say you went somewhere, there's a barbecue, you can't enjoy your nyama choma or something like that. You need to improve your quality of life.
Quality of life is key here. I think that is in line with this question from one of our viewers. She's saying, I get heartburn when I take spicy foods and coffee. Do I completely avoid them?
There's an option of avoiding, you avoid what triggers the heartburn. It's always advisable. Don't force yourself into issues. But if you are starting now noticing that you are getting heartburn or acidity against other foods, you need to come for a checkup. We check what could be the reason behind that. But just avoid what usually triggers your heartburn.
All right, and I think this is very also important for our viewers. Imagine someone is dealing with acidity or heartburn. How do they strike a balance between eating their foods and then also living like without compromising their nutrition status, things like that? How do you strike a balance? So you have acidity and then your nutrition.
Yes, we usually work hand in hand with the nutritionists because they usually have a way of balancing out your food. What works for you? Don't force, okay? Whatever, let's say you work with ndoma, you're comfortable taking your arrowroots, work with that. Don't take sweet potatoes to substitute your arrowroots because they are better or anything. Work with what works for you. Okay. However, you have to be careful not to go into malnutrition. Yes.
Malnutrition.
Yes.
Is very important because now that when people really have been having this information that this food can bring this, you avoid it. You talked about something key, immunity. Yes. Compromising your immunity if you don't have enough nutrition. True. I think that's very important. We're really enjoying the show, and we cannot really answer all these questions. I see so many coming in, but as we conclude, probably you can give us your parting shots. What do you want our viewer to take home from this conversation? Number one,
this condition known as heartburn and acidity affects your life. It affects how society takes you. There are people who, when they visit somewhere, they are already considered special because they don't eat certain types of food. So your quality of life becomes a problem. So this is a condition that affects your quality of life. And if it's not taken care of, it will also go ahead to affect other parts of your body. As we talked of, it can give you atypical signs of asthma. So you find people who are coming in with inability to breathe because they have asthma-like symptoms, and yet their problem is the abdomen. You can also have heart pain, that's going to the heart. Though when you investigate the heart, you're told the heart is okay, and yet your problem is actually your heartburn. You can also say, as I said, it can also give you throat issues. And when you have the throat issues, some people end up having tumors in their throat, courtesy of heartburn. And heartburn, if it's not addressed, and it takes a prolonged period of time without being addressed, sometimes leads to malignancy, especially cancers of the esophagus, and sometimes even cancers of the stomach. So this is a condition which is curable. This is a condition which will improve your quality of life if you address the real reason behind it. And then finally, don't take over-the-counter medications for a long period of time. You're always over the counter. Please know why you're having your heartburn. If you know why you're having the heartburn, you'll be able to address it, and sometimes the solution is permanent. You come, we do something for you that sorts you for life. Please, also the other thing, don't self-medicate. And when you're put on a prescription, always complete your dose. We are having a problem in the industry with drug resistance, and it cuts across, whether it's doctors who are dealing with chest, doctors who are dealing with urine symptoms, people who are not completing their doses are giving us a lot of trouble with antibiotics especially. So please complete your prescription. As a parting shot, you're always welcome to visit us. You can visit me at JCK Hospital, which I also sponsored the program. I also have my private clinic at Membley along the bypass. We are around 2 kilometers from Thika Road. We are a 24-hour facility. When you come there, I have a colleague who also deals with the same condition. We are 2 doctors who are there. And when you we will be able to address whatever issues you have. My telephone number is 0728 928 300. You can always reach out anytime. I'm available. Thank you so much, and God bless.
Thank you so much, Dr. Njihia, for your expertise. And for those of you who have been part of this journey, you can tell it's important to address the real cause of your heartburn and acidity before it becomes something worse or something bad. The goal is to improve the quality of your life, which is very, very important. And I need to say this, we are starting the Transform Africa Faith Conference right tomorrow, and JCK Hospital is right here to offer you the health checkups. They're going to do medical checkups and a lot of it. So this is a chance for you now to look into your health, even as you come to empower your spirit with the speakers that are going to be here with us. So it's important that your health is a priority. And of course, we also make a prayer as we conclude this show. We know that there are those of you who are watching us from hospitals, you at home, but you're always following. We pray for you, and we believe that your healing will come forth speedily. If you will say amen. My name is Enock Kitondekijja, and this is the Healthy You talk show on Faith Today Television. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.